Okay, so I'll tell you a little bit about our practice here. So Healthy Medical Centre is a large general practice situated in Geelong, West Victoria. We have an active patient base of over 13,000 patients from a wide range of cultural and socio-economic backgrounds. Participation in this trial was important to our practice to be able to improve access and provide inclusive care to our patients with intellectual disabilities. Our aim with this activity is to improve our process for the CHAPS assessment appointments for eligible patients to improve their health outcomes, but to also build effective relationships with all staff within the practice, to give patients and their carers the confidence to discuss and be proactive regarding their health needs. What we're doing here at Healthy, so currently we're in the process of making alterations to our clinic website, like adding an audio reader, as well as ensuring the language used is appropriate, positive and inclusive as per the Victorian Government guidelines. We're placing notes on patient files for specific needs and carer contact details. These notes are added to the patient details of the software and may include that a person prefers to wait in a quiet room rather than waiting in the waiting room, as well as the main carer's name or the preferred method of contact. We are working on making our accessible toilet doors easier to open. Currently, our toilet doors are really heavy to open and to hold the access and have the door open. We're in the process of getting quotes to be able to change these to automatic doors with a push button to make them easier and safer to access. Streamlining process for CHAPS appointments with the nurse and the GP. Our clinic has a fantastic streamlined system with our 75 plus health assessments. So we'd like to use a similar process with the CHAPS appointments, leading to a higher percentage of uptake for these assessments. Staff training to improve our knowledge and purpose of the CHAPS tool. And we're adding recalls to each person's file that have had a CHAPS assessment within the last 12 months. Updating the invitation to participate letter. These letters have been developed and include information as to what a CHAPS assessment is and includes easy to read information for patients and their carers. Outcomes and impacts. Effective reporting of the outcomes of the tasks on the previous slide then allow us to establish methods for patient feedback for continued improvement, leading to the practice to be able to continually refine this process. We would be developing action plans with timelines for the completion of enhancement tasks, completions of the PDSAs to improve accessibility and enhancements, and improve patient diagnosis reporting using codable diagnosis in practice software. Inclusion and sustainability. So being an inclusive practice for our patients, ensuring our patients have an equal right to access all medical facilities and emergency services. Build confidence to discuss issues with their providers and staff. Identify health needs early, prevents hospital admissions. Being sustainable, to make this project sustainable for our practice and to ensure that access remains inclusive for all our patients, we must add recalls and reminders added to patient files at the completion of their appointments. Been using regular Polar searches for new patients to send invitation letters, and continued input from GPs, nurses and allied health providers.